Hi, everyone, and welcome back to the Dr. MEK Anesthesiology podcast series.
Glad to be here.
We're here to, offer in-depth medical education.
Absolutely.
For those of you in residency or medical school.
Yeah.
I've been in anesthesiology for 14 years.
Oh.
I just want to share what I've learned
Of course.
with you all. But before we start,
Okay.
just a quick reminder, this podcast is for educational purposes only,
Right.
and it shouldn't be considered medical advice.
Got it.
You are listening to the Dr. MEK series, and if you enjoy our content, please consider subscribing.
Yeah, definitely.
Hit that notification bell for updates.
Yeah.
Okay, so today's topic is Brown-Séquard Syndrome.
Sounds good.
It's a rare
Yeah, it is.
neurological condition.
It is.
And to help us understand it better, we have a distinguished expert in neurology with us today.
Well, thank you. It's a pleasure to be here.
So Brown-Séquard Syndrome, or BSS, right?
Yeah, BSS, yeah.
It really, I think, showcases, the complexity of the spinal cord.
It does.
Damage to one side can produce
Right.
a variety of symptoms
It's so distinct.
that differ on each side of the body.
Yeah.
It's pretty remarkable, isn't it?
It is.
You'd think spinal cord damage, would have symmetrical effects.
Yeah, you'd think so.
But BSS demonstrates these very specific pathways
Really, really specific pathways.
within the cord.
Absolutely.
So can you maybe elaborate a little bit on the typical symptoms
Yeah.
and how they manifest on each side of the body
Sure.
differently?
So let's say we have a lesion on the right side of the spinal cord.
Okay.
On that same side, the ipsilateral side,
Mhm.
we would see weakness or even paralysis.
Wow.
This is because of a disruption to the corticospinal tract,
Right.
which controls voluntary motor control.
Okay.
Also, there would be a loss of proprioception,
Hmm.
that sense of body position, because of damage to the dorsal columns,
Yeah.
which carry that information up to the brain.
Okay. So on the right side, we're seeing a loss of motor function
That's right.
and proprioception.
Yes.
What about the opposite, the contralateral side?
This is where it gets really interesting.
Okay.
On that left side,
Yeah.
we see a loss of pain and temperature sensation.
Ah,
So that's a very different finding.
it is different.
And it's because of damage to the lateral spinothalamic tract,
Okay.
which, unlike the other tracts we talked about, crosses over
Oh.
or decussates at a lower level of the spinal cord.
Okay.
So a lesion on the right would interrupt those signals coming from the left side of the body.
I see.
Yeah,
So that's really interesting.
it is.
This idea of decussation.
Yeah,
So clinically, when we see this sort of dissociation, right,
yeah,
of sensory and motor deficits,
right.
what does that tell us?
It should immediately make you think of Brown-Séquard syndrome.
Okay.
This very distinct pattern
Right.
of ipsilateral motor and proprioceptive deficits.
Yep.
And contralateral loss of pain and temperature.
Oh.
That's like the key presentation.
So that's a red flag
Yeah, big red flag.
for us.
Absolutely.
You are listening to the Dr. MEK series.
That's right.
Now let's talk about the causes.
Okay.
What are the typical causes of BSS?
Well, there are a few.
Okay.
Traumatic injuries,
Like what kind of traumatic injury?
penetrating wounds,
Okay.
falls, motor vehicle accidents.
Got it.
Those are very common.
Okay.
Spinal cord tumors.
Right.
Those can compress and disrupt the pathways.
I see.
And then we have to think about non-traumatic causes too.
So non-traumatic causes.
Yeah.
Can you give us some examples?
Well, ischemia.
Okay.
Lack of blood flow to the spinal cord.
Got it.
And then certain infections or inflammatory conditions
Okay.
like tuberculosis or multiple sclerosis.
So those can also cause damage to the spinal cord,
Exactly, they can.
leading to Brown-Séquard syndrome.
That's right.
So really, a broad differential
Yeah, it is
is necessary when we think about BSS.
absolutely a broad differential.
So once we see this unique pattern,
Right. Yeah.
that raises our suspicion.
Yeah.
How do we confirm the diagnosis? Good question.
What are the steps?
So it starts with a good neurological history and physical examination.
Of course.
Really important to understand the timeline of when those symptoms started.
Yeah.
Any preceding events.
Right.
Any relevant medical history
Okay.
that the patient might have.
So really a comprehensive history?
Yes.
A thorough history.
An exam.
Absolutely.
I imagine imaging also plays a role, right?
Oh, absolutely.
In confirming the diagnosis.
Yeah.
And, pinpointing the lesion
Right.
and its cause.
Yeah. Imaging is key here.
So,
Primarily MRI.
okay.
That lets us really visualize the spinal cord,
Right.
see how extensive the damage is,
Uh-huh.
and often it'll help us pinpoint the cause,
Yeah.
whether it's a tumor, a fracture,
Okay.
or something else.
Now, if we suspect infection, then lab tests would be important as well.
Yeah, exactly.
Depending on,
Right.
what we see clinically. We might order blood tests,
Yeah.
cerebrospinal fluid analysis,
Yep.
or even biopsies
If necessary.
to identify the cause
Exactly.
and guide our treatment.
Absolutely.
You are listening to the Dr. MEK series.
Yes.
So now that we've talked about diagnosis,
Right.
let's move on to treatment.
Okay.
How do we approach treating Brown-Séquard syndrome?
Well, the treatment really depends on the underlying cause
Of course.
and preventing further complications.
Right.
So, for example, if it's a tumor compressing the spinal cord,
Yeah.
then surgery might be necessary.
Okay.
If it's an infection,
Uh-huh.
we need to give the appropriate antimicrobial therapy.
Now, what about steroids
Oh.
in cases of trauma?
Yeah, that's a good question.
I know that's often debated
Yeah, it is. It's controversial.
on spinal cord injury management.
You're right.
Yeah.
There can be benefits. Right.
But also some pretty serious side effects.
Okay.
And the evidence to support their use specifically in BSS
Yeah.
isn't that strong.
I see.
So you really have to make those decisions
Okay.
on a case-by-case basis.
So then the focus shifts to preventing those secondary complications,
Yeah.
like infections.
Exactly. Things like infections.
So,
We often use prophylactic antibiotics,
okay.
especially in trauma cases
Yeah.
where there might be a breach in the skin
Right.
or a risk of contamination.
And then beyond infection control,
Yeah,
supportive care is important too.
absolutely.
Things like pain management,
Yes. Pain management.
physical therapy,
Uh-huh.
occupational therapy.
To help them regain as much function as possible
Right.
and adapt to any limitations they may have.
It sounds like a multidisciplinary approach is really important here.
Oh, it definitely is.
Yeah.
Managing Brown-Séquard syndrome
Yeah.
often involves a whole team.
Okay.
Neurologists,
Yeah.
surgeons.
Right. Infectious disease specialists, rehab therapists,
Wow.
all working together
Yeah.
to provide really comprehensive care
Okay.
and optimize those patient outcomes.
And speaking of outcomes,
Yeah.
what's the typical prognosis?
Well, it can really vary,
Okay.
and it depends on a few things.
Like what kinds of things?
The severity of the injury,
Uh-huh.
the underlying cause,
Okay.
the patient's age and their overall health,
Yeah.
and how quickly treatment is started.
So it's really individualized.
Yeah, it really is.
Are there cases where people fully recover?
Oh, yeah, definitely.
So,
When the injury isn't too severe
okay.
and the underlying cause is treatable,
Yeah.
patients can have significant recovery.
Even complete recovery sometimes.
Sometimes, yeah.
And early intervention is key there.
Oh, absolutely. Early intervention is key.
But I imagine there are also cases
Right.
where the deficits
Yeah.
are more permanent.
Unfortunately, that's true
I heard
in
that.
those more severe cases
Mhm.
or when there's extensive damage.
So the spinal cord.
Yeah, to the spinal cord.
There might be some lasting disability.
There can be, yeah.
You are listening to the Dr. MEK series.
That's right.
It's really crucial for us as medical professionals
Yeah,
to understand the nuances of Brown-Séquard syndrome
absolutely.
so we can provide the best care possible.
I agree.
This condition really highlights
It does.
that relationship between anatomy physiology
Yeah.
and the clinical presentation.
It's so important to recognize that classic pattern
Yeah.
of ipsilateral and contralateral symptoms
Right.
so we can identify BSS quickly.
And get them the treatment they need.
Exactly.
For our listeners who are early in their training,
Yeah.
what are the key takeaways
Okay, well, first,
about Brown-Séquard syndrome?
you have to remember that distinct presentation,
Right.
ipsilateral motor, and proprioceptive deficits
Yeah.
with contralateral loss of pain and temperature sensation.
So that's the red flag.
That's the red flag.
And then understanding the anatomy
Yeah, the anatomy and physiology behind it.
and physiology
They're so important.
for diagnosis and management.
Absolutely.
It's like solving a puzzle, isn't it?
It really is.
The symptoms are the clues.
Yeah,
And neuroanatomy is the key
exactly.
to deciphering those clues
Uh-huh.
so we can get to the right diagnosis.
And it all comes together.
And once we have the syndrome identified,
Right.
then we need to figure out the underlying cause
Yeah,
and tailor the management accordingly.
absolutely.
You are listening to the Dr. MEK series.
Yes.
Before we wrap up,
Okay.
I want to touch on something else.
Sure.
We talked about the typical presentation,
Right.
but are there atypical
Oh, that's a good question.
or variant forms of Brown-Séquard syndrome?
Yeah, there can be some variations.
Okay.
While the classic presentation is what we see most often,
Yeah.
The specific location and extent of the lesion,
within the spinal cord
yeah, within the spinal cord.
can cause some differences
Right, it can cause some subtle differences.
in how it presents.
Yeah, in the clinical picture.
Can you give us an example
Sure.
of an atypical presentation?
Let's say the lesion is in the central part of the spinal cord.
Okay.
You might see more weakness
In the
in the upper extremities
Okay.
compared to the lower extremities.
Interesting.
Because those fibers controlling arm movement,
Yeah.
they're located more centrally
I see.
in the corticospinal tract.
So even though the principles are the same,
Yeah.
there can be variations.
Right. There can be various.
We need to be mindful of that.
Absolutely.
A thorough exam
Yeah.
and careful interpretation of the imaging are really important
Yes, especially in those atypical cases.
to make an accurate diagnosis.
Exactly.
You are listening to the Dr. MEK series.
Yes.
This has been a really great discussion.
It has been.
I hope our listeners,
Yeah.
especially those studying for boards,
Or on neurology rotations.
yeah,
Found this helpful.
found this helpful.
It's a fascinating topic.
And I really appreciate your insights today.
My pleasure. You know, medicine is a field of constant learning.
It really is.
And Brown-Séquard syndrome is a perfect example.
Yeah,
It reminds us to, approach each patient with a fresh perspective.
absolutely.
Keep in mind both that classic presentation
Right.
and the potential for those subtle variations we discussed.
You are listening to the Dr. MEK series.
Yes.
I want to thank our expert
Oh,
for being here today and sharing their expertise.
my pleasure.
It's been a really great discussion.
It has.
I hope our listeners,
Yeah.
especially those preparing for boards or,
Right.
working through neurology rotations,
Yeah.
found this helpful.
I hope so.
Understanding, the anatomy and physiology
Absolutely.
helps us connect those symptoms
It does.
that seem paradoxical at first.
Right.
But ultimately, it allows us to, provide more precise care,
Definitely more precise care.
more effective care.
Absolutely.
Before we conclude, I want to leave our listeners with something to think about.
Okay.
We've talked about the neurological effects of Brown-Séquard syndrome.
Right.
But what about the psychological impact
Oh, that's a good point.
on patients?
Yeah.
Imagine,
Yeah.
this sudden loss of sensation or mobility
Right.
on one side of your body,
Yeah.
and then these maybe even confusing sensations
Right.
on the other side.
Yeah, that would be very difficult.
What kind of emotional and mental challenges
I
might that
know.
present?
The psychological burden can be significant.
I imagine.
Fear, anxiety,
Yeah,
even depression,
right.
as they cope with the changes to their daily lives, their
Yeah.
independence, their
Right.
future.
It's a really important reminder
It is.
that as healthcare providers,
Yeah.
we need to care for the whole patient,
The whole patient, absolutely.
not just their physical symptoms.
Right.
Addressing those psychological and emotional needs
Yeah.
is just as important
I agree.
as managing the physical symptoms.
A holistic approach is essential.
Absolutely.
Combining psychological support
Yeah,
and counseling
right.
alongside the medical management.
To really optimize their well-being
Exactly.
and long-term outcomes.
Yes, their long-term outcomes.
This has been a really insightful conversation,
It has.
and I hope our listeners
Yeah.
have gained a deeper understanding
Yeah.
of Brown-Séquard syndrome
Absolutely.
and the impact it has on patients.
It's a fascinating condition.
You are listening to the Dr. MEK series.
That's right.
I want to thank our expert again
Thank you.
for joining us today.
It's been my pleasure.
And to our listeners, thank you for tuning in.
Yes, thank you.
Be sure to subscribe and hit that notification bell
And we'll see you next time.
for future episodes. Until then, keep learning.